For being here. Thank you. Thank you guys for being here. This is the Faith Community Research Network's virtual resource fair. I will just start out with an overview of tonight's event. So we're going to start out with a welcome and a prayer by Pastor Rochelle Chapman. Then we will go into the community organization presentations. We have 11 great organizations with us today. And each organization will be presenting for 5 minutes. That'll take us from about 6:15 to about 7:20. And then we will move into a virtual networking session where you'll be able to join a breakout room of the organizations that interest you the most and network with them, ask questions, things like that. Then we'll come back into the main room for a wrap up. So I don't see the button to change slides. 1 second. Great. So we're going to start out with a presentation from Brittany Dow.
Hello. Hey. Okay. Hi, good evening, everyone. This is Dr. Haley Thompson. I'm sorry that I'm not on camera. I apologize for that. I just wanted to just jump in and welcome everyone to our research board this evening and maybe say a few words about the Faith Community Research Network. But before we do that, I want to turn it over to Pastor Chapman, who will lead us and open us up in prayer.
Thank you, Haley. I was thinking the same thing. Let's pray. God, we thank you for this privilege and opportunity to come together, to collaborate, to learn from one another, to have resources so that we can prosper and be in health even as our soul prosper. We pray that you would open up our minds, that we are clear to hear, and our ears that we can hear what it is that you're saying, that we might apply this to our everyday life, in the lives of our congregation, in the lives of our community. We thank you now and we bless you in Jesus' name we pray. Amen. Dr. Thompson, thank you. I'll pass it back over to you.
Amen. And actually, like I said, I'm not in a place with a lot of background noise, but maybe you could share the foundations, like the origins of the Faith Community Research Network, what we're trying to do, and where we are today.
Absolutely. Sure. Yeah. So, okay, good evening again, everyone. The Faith Community Research Network, we're glad that you are here. This is our second iteration of the Prosper and Be in Health fair. And so we started a few years back with a collaboration between the Faith-Based Genetic Research Institute, as well as Carmano's Cancer Institute and Wayne State University as a collaboration starting with 12 churches, building capacity. We went through building a capacity curriculum about genetic and genomic research, things about immunotherapy, expanding the health education of church pastors and other lay health believers as well. And so we went through that curriculum for a couple of years for our Genomic Research Action Council, and the Faith Community Research Network has now expanded through funding through the DMC Foundation to 16 network churches, hosting various different programs like our Medical Mythbusters, which we did surveys of the churches to see the topics that were most interested in those communities and congregations, and that was like COVID-19, cancer, and we talked about hypertension as well. And those aired on Rhema Television Network. I don't know, Bishop Lloyd and Rhema folks may be on here tonight, but it aired for 3 consecutive Fridays on Rhema Television Network. And then we also hosted these wonderful watch parties at 6 of our network church locations, and folks watch hybridly as well, just expanding that medical education. And so one of the things that we did for the first time was in December to have our first health ministry workshop as a network at Second Ebenezer Church. That went really, really well. And I think most of you, or a lot of you that I'm seeing on here, was a part of that as well. And so we're doing great work in the community with churches, trying to build the capacity for health ministries to make sustainable health ministries and getting the access to the education and things that you may need from us. And so that's just a brief overview of Dr. Thompson. Want to add anything else about the Faith Community Research Network? And thank you all for coming today.
Dr. Thompson, do you have anything to add?
Hi, yes, like I said, I'm sorry, like I'm not in a place where I can speak, but I wanted to be here to just support this event. Thank you everyone for being here.
Awesome. Thank you so much for that introduction and prayer, Rochelle. We will continue with Brittany Dow from the Office of Cancer Health Equity and Community Engagement at Carmanos. So you can take the stage, Brittany.
Hi, everyone. Thank you so much for having me today. I'm so sorry. I'm having some issues with Zoom and my camera, so I can't be on camera. So I'll just hopefully, yeah, I can't be on camera. Okay. So today I'll be talking about KCI's or Carmanis Cancer Institute's Office of Cancer Health Equity and Community Engagement, or OCHEC. Next slide, please.
Sorry, I'm not sure why it's not changing slides. 1 second.
So just an overview over Carmanis Cancer Institute, or KCI. KCI is a National Cancer Institute NCI designated comprehensive cancer institute. There are only 53 in the country, and to earn this distinction, a cancer center must demonstrate scientific leadership in basic, clinical, and/or population sciences. The
Uh-oh, Brittany, I'm not sure if you accidentally muted yourself. We can't hear you.
I think she may have dropped off completely.
Okay, I will continue. I actually work with OCHEC, so I can continue the slide. We are funded by a NCI National Cancer Institute Cancer Support Grant through Wayne State University, and this is reviewed every 5 years. So an overview of OCHEC. It was established in 2017. It has primary responsibility for the community outreach and engagement here at KCI. It identifies needs and disparities in the catchment area and ensures that KCI science is aligned with needs to reduce cancer burden. Over here, you can see an overview of our staff. At the top, we have Dr. Haley Thompson and Brittany Dow. We have Carrie Snyder, Maida Herrera, Fair Steele, Von Seal Brown Miller, Madison Pavlisak, Zainab Ahmed, Zachary Chichon, Danielle Marshall, Ali Faki, Michaela Harrison, and Maglina Mihailova. There are 2 COE scientists who conduct community-based research along the cancer care continuum. This is Dr. Kristen Mackey and Dr. Ariel Washington. The KCI community outreach and engagement has 4 specific aims. 1, to monitor cancer burden, disparities, and needs throughout the KCI catchment area. 2, to facilitate community stakeholder engagement in all phases of cancer research and control efforts. 3, to link community outreach and engagement efforts to the development and implementation of research across basic, clinical, and population sciences. 4, to promote and implement strategies and policies to reduce the cancer burden in the KCI catchment area. And a part of OCHEC is the Carmanos Academy, which is focused
Can I, I'll jump in here. Okay, Kayla, can I jump in here? Yeah,
Yes.
so what do we want to share with the congregation today? Because we planned this whole meeting to include organizations and programs that are prepared and ready to partner with churches, to bring programs and resources directly to churches. So here is a part of our effort and our initiative that is aligned with that is Carmanis Academy. And through this, it is largely based on our efforts to teach health ministry members as what we call lay health advisors, or train them as lay health advisors. So a lay health advisor is someone who doesn't necessarily have any kind of medical or clinical degree, but someone who wants to share health information with his or her community. So that is what we're doing. We're preparing just regular people to share information about cancer screening, cancer prevention with their community members, and in this case, with their congregations and people beyond. So we have a number of projects. The first one that we're rolling out is actually called Real Talk in the Cancer Prevention and Detection section. In April, we're hosting our first training. Well, again, we're going to train people who are interested to teach other folks, particularly in this case, women, about breast cancer screening, breast cancer risk factors. We'll be talking about genetic risk for breast cancer, which is something that a lot of people don't know about. And again, prepare health ministries to do this work on your own. So we're starting with that. We're also including Project ACE, which is going to be HPV vaccination. We also have similar programs coming down the line on clinical trials. And we also do a lot of education around research and teaching people what research is. So we have a whole curriculum that can help people build their skills when it comes to research. And it's all just meant for people in our communities. So that's something that we want to offer to all of you, to all the churches and the broader community, the opportunities to get involved with Carmanis Academy and to learn more so that you have the capacity to do more. And I think that's about it.
I believe so. I think there might be one more slide. Let me check and see. Yep, you went over the lay health advisors, building your capacity curriculum.
Hold on, let's go back for a
anyone-
second. So we're actually, can you go back one? Because we're actually enrolling people. The Building Your Capacity curriculum is the program, the training I just talked about to train people in kind of just the basics, the very basics of research and evaluation, which can be useful, I think, not be in the health realm and beyond. So again, we'll share this information with you beyond this meeting, but we're going to start on April 16th. That's our next cohort. It's about 5 sessions, and we welcome everyone. I think that's it.
It is. Thank you, Haley. Thank you, Kayla. I
No
just got
problem.
that.
Thank you. Okay, so next we have Megan Landry from the American Cancer Society to tell you a bit about the American Cancer Society.
Yes, thank you so much. I know we each only have a few minutes, so I would love to cram absolutely everything the American Cancer Society does into these few minutes, but I don't want to overwhelm everybody. So I'll just share, our 3 main tiers are research, advocacy, and patient support. So we are the largest private nonprofit funder of cancer research in the United States. And then we have advocacy presence in all 50 states and talk to our legislators about issues that are facing that cancer patients face. And then our patient support, which is really how I see how we can work with you, because I'm sure that all of you are working with people at your churches that have been diagnosed with cancer or need resources. So we have materials, we have a Road to Recovery program where patients can get rides to treatment. We have transportation and lodging grants through our health systems. We have navigation services, an 800 number that you can call 24/7. So I'll get into a little bit more of that, I think, on the next slide. So some of the resources that we can provide to you to enhance your health ministry, or what you can do, you can refer cancer patients to the American Cancer Society. That 800 number that's on the slide, a live person answers that phone 24/7, 365. So if you come across somebody who needs information, that is the number to call. We also have a dedicated space on our website to find resources if you're looking for support groups or lodging or discounts on wigs. You can find all of that there. Road to Recovery and Hope Lodge are our transportation and lodging programs. You're able to order materials from us for if you have health fairs or other events. I put a little screenshot on the far right there of just all the landing pages on our website for what we can offer to support patients. And then I really wanted to just quickly talk about our Voices of Black Women study, which is coming in May. Michigan is one of the states that this study will be coming to. So Voices of Black Women is a population cohort study led by the American Cancer Society. We're going to aim to enroll at least 100,000 Black women. Through this study, we're going to be examining family history, social support, and lived experience to better understand cancer and other health conditions among Black women. The study will give the American Cancer Society insight to implement interventions for Black women, both in their individual lives and within systems to improve health outcomes for the next generation. We know that Black women are significantly underrepresented in research. And so this is an area that the American Cancer Society is growing in, and we're really excited to be bringing it to Michigan. I'm sure there's gonna be a lot of questions about that. Feel free to hop into my breakout room. You can go to the last slide. So this is just my contact information. You're welcome to reach out to me. I work with our cancer center, so that's how I am connected to this group with Carmanis. And then my colleague Zara is our director of community partnerships. So she's really going to be the one that will be on the ground working with churches. You're welcome to reach out to her as well. She is going to be on maternity leave in a couple months, so feel free to just reach out to Zara and we will make sure to get you the right information.
Awesome. Thank you so much, Megan. We are going to continue with a presentation from Diana Garcia on Sister Friends and the Detroit Health Department overall.
Friends Detroit, stepping in for Diana. So Sister Friends Detroit is an initiative that we began in 2016, 2017, where our goal is to recruit and train and connect women, pregnant mothers, with volunteer mentors to support them throughout their pregnancy. So the whole goal of Sister Friends Detroit is to reduce the infant mortality rate and to provide pregnant women in the city of Detroit with resources that they may not have known or had prior to joining our program. Next slide. And with that, our goal is to recruit more mentorship. So this brings us to the first one is our mentors support our pregnant moms, providing them with social, emotional, spiritual support. We connect with our moms by joining sessions like this, going out in the community, meeting with faith-based organizations, joining our medical facilities and clinics to recruit our mothers. And then for our mentors, we're all over Wayne County looking for mentors to join our program, reaching out to sororities, different church groups, and we have billboards. We've done news clips as well. We're on social media, anything that we can do to have that network of mothers and mentors meet each other. And we work from the Detroit Health Department. It's actually under the Detroit Health Department. A lot of people don't know that. We're at 100 MAC. So we have a variety of other programs located there that I'll talk about a little bit more later on as well. Okay, it's the Sister Friends journey. It's a 2-minute video. I'm not sure if you're able to share the video. If not, then I can talk about it.
It doesn't look like it's embedded in the slide. Are you able to do, oh, I think it's right here. Is it? Perfect.
Kayla, you need to reshare your screen and click the share sound box.
Okay, thank you.
Yeah.
Because they Sister Friends, anybody who's about to have a baby should be signing up with Sister Friends Detroit because they have the knowledge and the resources to support all of the parents. Both mothers and fathers can sign up. They have a fatherhood program as well. Sister Friends actually provides Lyft rides to help you get to appointments and back and forth. Other than tangible resources, I also received breastfeeding support. I was able to find a birthing class for free. I was able to connect with a birthing center instead of having to have my baby in a hospital, which was something I wanted to do. Making sure that you are armed with all the information that you need to go back to the doctor's office when they say, hey, we want your baby to be this weight, and you should give them formula that you can say, hey, no, I know exactly what I'm doing because I have these professionals here, breastfeeding consultants and certified IBCLCs backing me up. Just, I don't even know. It's an immense blessing, honestly. If you've been in other programs and they haven't worked out for you, this is not the same. And they are actually connected to a bunch of other programs, so somebody will have what you need. The program continues until your baby is 1 year old. So they keep you on track with breastfeeding and making sure that your needs are met, that whatever resources that you need, whether it's food or if it's housing or if it's the pack and play and car seats, just making sure that no matter what it is, you can come to them. You have a centered place to get whatever you need. After my baby was born and the breastfeeding support continued, I was able to be connected with a mentor who happened to be a nurse, and that was extremely helpful. I'm sure that everyone's mentor is not a nurse, but they're coming as people who are interested in helping you. So they find the resources and they find the answers to support you. She is now 1.5, but I'm still in the program because I signed up to be a mentor as well. Everything that I learned, everyone that I met, I'm taking all that information and making sure that someone else is able to get that information as well. I love the community that I've built here. And Sister Friends Detroit is a program that will not give up on finding those resources for you.
Thank you so much for that. So that's the video that we share to our partners to let them know that this program is successful. Even though it's new, it's successful. We have Asia was in the program as a little sister, as she stated, and now she's a mentor to a little sister. So we want to create that underground railroad of success, of wealth of Black women growing and thriving amongst the city of Detroit. And I just have a few more short slides. The next slide is our resources that's located in the Detroit Health Department. As you see, we have a ton on there, and we have more. These are definitely not all of them. We have Children's Special Healthcare Services, WIC, Behavioral Health, and you can go to the next slide as well. These are just some of the programs that we have located at the Detroit Health Department. And then we have a resource database of over 70 plus resources that we connect our mothers with. So if we don't have it, we connect it with someone else that do have it. You can also come to the health department to pick up any flyers. I know that I'm here to represent Sister Friends Detroit, but Maternal Child Health, we represent Sister Friends Detroit, Fathers Forward, and the Safe Sleep program. So we're the trio that's out here in the community trying to bring as much knowledge to our women and to our families so that they can be successful. And then the last slide, like Megan said, that is our hotline number. So you can call that number. A live person will answer. They'll do an intake and then connect the community with any resources that we have and any resources outside of the health department as well. So thank you so much.
That was so insightful. Thank you so much. We are going to continue with a presentation from Andrea Rogers on Hagera Health.
Good evening, everybody. I am Andrea Rogers, the Director of Development here at Hagera Health. So we can go to the next slide. So the joys of virtual fair, that's my trier background going on. But Hagera Health is one of the oldest comprehensive healthcare clinics within Wayne County. We've been around since 1971. And we service the entire Wayne County region. However, our base is Western Wayne County and the Downriver areas. And so when I say a comprehensive array of services, the word Hagera actually means journey. So wherever anyone is in their journey, whether it's gender, whether it's age from infancy all the way to older adulthood, whether it's mental health services, substance use services, primary health, medical care, we are what I would consider a one-stop shop. Wherever you are in your journey for wellness totally, we can assist you and team up with you. One of the things that I'm most proud about Hagera Health is that we are what's called a CCBHC, which is a Certified Community Behavioral Health Clinic. Basically, what all of that means is if you are underinsured, if you hi there, Dr. Haley, so good to see you. Thank you for that. If you are underinsured, if you have no insurance, we have services that are accessible for you. And so it's not just services when you're in a crisis, we have prevention services as well. So a lot of people know about Hagera because of our psychiatric facility. We have an adult psychiatric facility, COPE, which is in the area of 96 in Newburgh. Or we have a great relationship with 12 municipalities. And so what that means is now we have police departments who are allowing social workers on non-urgent calls so that we can respond to mental health crisis in real time, where it doesn't have to be a police officer dealing with it by themselves, but we have embedded clinicians where social workers are going and responding or receiving referrals for services. So we're really proud of what we're doing. Our mission is not just wellness first, but one of the things that I love is it ends with and does start with integrity and resolve. We don't want to just come in and kind of get you started. We want you to keep your integrity, us to keep our integrity, and we want results. We want to be effective in the services that we provide. Next slide. So just a few of the things that we would love to partner with other organizations is we are what's called a zero suicide organization. So I'm not going to go through everything on the slide, but what that means is our goal is 0% suicide. We know that those who are receiving effective treatment and behavioral health care and are responsive to that treatment, it is effective in making those numbers decline. And so whether it's mental health awareness, making sure we reduce the stigma of not just mental health, we talk about the stigma to mental health, but substance abuse has an even bigger stigma. And so what we know is that people of color or people in poverty don't want another strike against them. So it is less likely for those populations to reach out for treatment because of the stigma. So we are here to talk about encouraging early intervention. We want to encourage treatment seekers so that everyone knows that, yes, there are disparities in mental health care access and outcomes, but we are working very hard to address those. We're talking about stress reduction across the board, resilience building across the board. It's one of the things about COVID, I call it the equalizer. It put everybody on the same pathway. So we want to have these conversations. Sometimes it's more about might not have all the answers, but it's about asking the right questions to get to the right answers. Next slide. One of the other things that we really want to focus on is policy development. So we want to be grassroots, making sure that we're getting services into the hands of those who need it, but we need policy development so that those services can continue and be accessible. The information on your screen is how to schedule an appointment, whether it's for mental health services or at our Oakdale Recovery Center for substance abuse treatment. Our website information is listed there as well, and my information. If you ever have any questions, this is what I do. This is my passion. So feel free to reach out, ask questions, and let's figure out how to break this stigma together. Thank you.
This was awesome. Thank you so much, Mrs. Rogers. We are going to continue with a presentation from Barbara Garcia from the National Kidney Foundation.
Thank you. So good afternoon, everyone. My camera's acting up a bit, so I hope everyone can see me all right. I'm Barbara Garcia. I'm a program specialist with the National Kidney Foundation of Michigan, which is an amazing organization. It was established in 1955, so that tells you a lot of like how long we've been around. But of course, one of our biggest missions is to prevent kidney disease and also help those who are currently living with it. Unfortunately, nowadays, many adults live with chronic kidney disease and don't even realize that. So we do more than just like servicing people with chronic kidney disease. We have preventive programs that we'll cover in the next slides, that we offer from like childhood all the way through like adulthood and senior years. We have 3 locations, Ann Arbor, Grand Rapids, and Detroit. Our headquarters is in Ann Arbor, but we're also very community-based. So you will always see us out in the community. We try to collaborate with nonprofits, community health clinics, as well as faith-based organizations. Next slide. So first of all, I know it's 5 minutes, so I'm trying to be as fast as I can. And if you have more questions, you know, you're always welcome to ask those throughout the breakout room or send me an email, or you can call me. But these are some of the programs that we offer for kids and family. Again, all the programs that we offer at the National Kidney Foundation of Michigan are free. They have no cost for the most part. They're also offered via Zoom. So if people don't have transportation or it's hard for them to get, you know, to a location, that's not a problem. So first, real quick, I'll talk about our kids programs, which includes the Reggie Rainbow Adventure. That one and the Go Knapsack, those are mostly for early childhood programs. So anyone that has a Head Start, any early childhood program like GSRP, or even like daycares. Oh, can you go back? Thank you. Yeah. These are all programs that, you know, you can reach out to me or directly on our website. And it's basically programs. The Reggie Rainbow is an 8-week course. And it's basically for kids to learn about nutrition, you know, because we have to start them young, right? To prevent these like adult chronic, you know, conditions like diabetes and high blood pressure and chronic kidney disease, right? The Peanut program, that's for school-age children. And again, we have like certified staff, you know, that are experts in this. So they'll go out and train the staff, train the teachers, so that the teachers can carry on these programs. Then we have Cooking Matters at the Stores. This program is for families and children. So basically, anybody interested in learning more, whether you're a parent or a guardian, we can give you the resources and the tools so that you can learn how to cook healthy with your children, learn how to budget when you're at the grocery store, and you do it along with your children. Okay, next slide. And then we have the adult programs, which for the most part, they tend to be for people who already have a chronic condition, but we also have programs for people that are trying to prevent, right, these illnesses. So we have a Matter of Balance, which basically all these programs are between 6 and 8 weeks long. A Matter of Balance helps people learn like how to maintain like a healthy lifestyle, walking, exercising. We also have the DPP, which is Diabetes Prevention Program. This program is a year long. However, it's a great program as well. This is for people who are pre-diabetic or who might, you know, there's diabetes that runs in the family, or who are dealing with obesity or have lack of, I wouldn't say lack, but are unable to, they have a sedentary lifestyle. So this is a great program for people that want to prevent diabetes type 2. Again, it's a year long, but for the most part, the 16 first weeks, we meet once a week. And then after that, it's monthly. They're also offered via Zoom. It's only an hour once a week. It's very manageable, and it's free again. So it's covered by Medicaid, but if you don't have access to Medicaid, it's completely free at no cost. We also have an Enhanced Fitness. Again, this is a program that meets weekly. We have PATH, which is for people who have chronic diseases, and this can be arthritis, this can be diabetes, this can be chronic kidney disease, anything that qualifies as a chronic disease. This is a great program for you or for anybody that you know that might be interested. This is offered via phone in Spanish. We also have these programs, I forgot to mention earlier, they're bilingual. So some of them are in for Spanish speaking community members as well. With PATH, I believe in person, it's a 2.5 hour weekly meetup, but it's only 6 weeks long. And every week you cover a different topic on how to improve and how to manage, right, your daily life as you're dealing with a chronic illness. Then we have Better Choices, Better Health, which is another program that helps you, make better choices, right, when it comes to eating and your health in general. Then we have Walk with Ease. So again, this is for adults too and seniors that want to improve the ease of walking and just like physical activity. Many of these programs, again, are offered via Zoom, so you can do it from the comfort of home, again, at no cost. We also have Wise Women, which is for women between the ages of 40 and 46, I believe. And basically, it also prepares them with help just, being healthy and managing if you do have, a health concern, like how to manage that, where to go, and this is specifically this program too is for women who are uninsured or underinsured. And then we have the high blood pressure HPV control program, which is also a self-management program. So this is for anybody that has high blood pressure or where hypertension runs in the family. It's a 6-week course. They meet for about an hour and a half weekly. And it's just, a great way to acquire tools and skills and, how to learn how to navigate, right, through all these illnesses and chronic conditions. So I highly recommend that you check out our website. That if you have any questions, I know I'm going by really quickly with all this information, but I invite you to please send me an email, a call, join the break room, and I would be glad to talk more in depth about these programs. Next slide. And so here you have the general information, but again, I'll be glad to give you my personal information as well. We do offer direct services for people who have chronic kidney disease or are going through dialysis. We have direct patient services that we can offer, like if people need help, paying a DTE energy bill, we might be able to connect them, right, with somebody that can give them that assistance. We also offer scholarships, a one-time scholarship. We have a peer mentor and support group as well. And then we also have those evidence-based programs that I was telling you about. That, everyone's welcome to join those, community members as well as people who have chronic kidney disease. But here's our website, our direct phone number with our extension, if you would like more in-depth information. And you can also follow us through our social media channels. So thank you.
Thank you so much, Ms. Garcia. We are going to continue with a presentation from Rochelle Chapman on CURES, or the Center for Urban Responses to Environmental Stressors.
Awesome. Thank you, Kayla. Again, you already said the acronym, so I don't have to. It's a mouthful. But I am from CURES, the Community Engagement Coordinator, also the co-director of the Faith Community Research Network, and a senior pastor alongside my husband in Detroit. You see our incredible team here of Dr. James Blessman, Carrie Leach, and Nicholas Schreck. It's important to mention them. Nick is an environmental lawyer. That's good for the advocacy part of it. We have Dr. James Blessman as a medical doctor, and Dr. Leach, who is in community health and participatory research, and also at the Institute of Gerontology. Next slide. While you're turning, in addition to those, we do have 2 community advisory board leaders, Melissa Cooper Sargent and Sandra Turner Handy, which is important because we work directly with them. So who are we? Technically, the National Institute of Environmental Health Sciences core. We're a P30 center led by Dr. Melissa Runge Morris and Christine Cole Johnson. CURES aim to understand and mitigate the adverse health impacts of exposures to complex and non-complex chemical stressors in a complex urban environment. We foster mutual beneficial dialogue and co-learning experiences with researchers, local advocates, as well as stakeholders and residents. We serve as a resource for environmental health information, which I'll talk a little bit more about in a moment, expertise, and advocacy. Primarily, we want to promote environmental health science and awareness and advance the science of community engagement. Next slide, please. Disease prevention. Here, we want to be proactive versus reactive. Living and working in Detroit, the impact of urban industrialized environment on our health. Listen, over time, we have chronic low-level exposure to environmental stressors, which lead to adverse health conditions and diseases. Our stressors include such factors as air, water pollution, workplace chemicals, particulate matter, emotional, psychosocial stress, dietary things, as well as some populations are at a higher risk: children, older adults, those with low-income backgrounds, refugees, immigrants, workers with certain occupations. Furthermore, there are specific life windows where people are at a heightened risk, such as during pregnancy and lactation, puberty, old age, and during times when the immune system has weakened. Again, our goal is disease prevention through community awareness and public policy change. Next slide. So delivering environmental health programs to your church. A little bit more about what we do at Cures also is thinking about the social determinants of health. We ask about what are those? What are the social determinants of health? Social determinants of health are the conditions and the environment where people are born, live, learn, work, play, worship, and an age that affects a wide range of health functioning and quality of life outcomes and risk. And so we want to educate on those programs. I see one of our program leaders out here, Dr. Graham Parker. We educate in the community. We come and we bring our researchers. We have spinoff events and environmental health chats, which we call e-chats. We have these fact sheets that's on here, like the one you see, COVID-19. That's the front of one. We also present some things that have disinfecting 101, how to disinfect and clean your house. You know, when I was growing up, we didn't know that, you know, we didn't think it was clean unless it was burning our nose or the house smelled like bleach and things like that. But we have some healthier ways to clean and to disinfect your home. We have those type of fact sheets on various different topics. So we will send those to you, deliver those to you. Our spinoff events, we will host those in person at your church, at your organization, on different environmental health topics: lead, water, climate change, asthma, all of those type of things. And we talk about environmental justice and environmental health and how it impacts your everyday life. When we come to do those events, there's an incentive of a $10 CVS gift card for each person that is in attendance to those events. We also host events. Pastor Rogers, who was on here earlier, we did an event with her with coping with stress. And then we did an event on Is My Home Poisoning My Family? Pathways to a Healthy and Lead-Free Home. When I go out and present, a lot of times I talk about environmental health, but I talk about everyday environmental health. How does this affect me in my everyday life? You know, sometimes going to people visiting their house and they want you to take your shoes off at the door. I thought maybe they were being bougie, but no, they didn't want to track, you know, all type of matter and pollution and different things like that in their home. Here are some staggering numbers that I want us to think about tonight. That over 3 million trucks pass through the Ambassador Bridge every year. Think about all of the pollution that's happening with that. But hospitalization, and Graham's on here, he knows better than me, but that Detroit is 3 times higher in terms of hospitalization than the nationwide average for asthma. And we think about, we see all these great and wonderful community gardens, but you wonder, have people tested the soil before they planted those, you know, vegetables and those fruit, because it can have lead in the actual soil. And so I'll leave you guys with this last thing. We were on a community advisory board meeting. I want to tell you also, we have over 23 community advisory board members and access to organizations from the Detroit Public Health Department to lead education to the Ecology Center, so many different resources that are on here. So those are resources that we can connect you with as well. But there was a young lady, the story was, there was a young lady who was disciplining her child for over 2 years because her child had behavioral problems, was acting out in school, wasn't concentrating, had trouble sleeping. And someone finally gave her a revelation to get the child tested for lead poisoning. And in fact, the child had lead poisoning, broke the mother's heart because she just thought that, her son or her child was just being bad, if you will, or just acting up. But in all actuality, one of the signs or one of the symptoms or one of the things that you could see about lead poisoning is a change in behavior in your child. And so what I try to do when I go out in these environmental health chats is, how does this affect your everyday life? And I won't even begin to talk about, the kids that are pumped up on Ritalin and Adderall, and folks are saying they have ADHD. And it is possible that they could have lead poisoning instead of attention deficit disorder. And so these are the things that we want to help you out with. We have a mobile health unit that will come out to your church, that will come in your parking lot, come out to your organization, and we can connect you with those things. Thank you very much. I'll put links and everything in the chat. My contact information should probably be the next thing. Thank you.
That was wonderful. Thank you so much, Rochelle. Before we continue on to the next presentation, I just wanted to remind everyone that after we have had all of the organizations present, we're going to do breakout rooms as a part of a virtual networking session. So you'll be able to navigate to the bottom of your screen and you'll see join breakout room. And all 11 of the organizations will come up. You'll be able to join one of the rooms and ask questions, network a bit more. I'll go more in depth into this towards the end, but I just wanted to remind everyone because there are quite a few people who have joined since I mentioned it first. Now we will continue with a presentation from Sydney Austin from the Leukemia and Lymphoma Society.
Hi, everyone. Thank you, Kayla, and Dr. Thompson and team for setting this up. This is great. But my name is Sydney Austin. I am the Community Outreach Specialist at the Leukemia and Lymphoma Society. At the Leukemia and Lymphoma Society, our mission is to cure all blood cancers and provide, I see you, Megan, our mission is to cure all blood cancers and provide resources and support to patients and their families who are navigating blood cancer diagnoses. We do this through 3 ways: through research, advocacy, and support. But my job here in Metro Detroit is to make sure everyone knows of the free support resources that we do provide. Personally, as a Black woman, I'm fueled to do this work because I'm determined to make sure that we as a Black community are no longer the last ones to know about resources that are out there, especially if they're affecting us in a particular type of way. My own grandmother was diagnosed 4 years ago now with a blood cancer called multiple myeloma. And of course, she doesn't have access to all of those resources. And so it took a long time. Really, it took me coming in to help her navigate through some of these things a year ago. I'm also noticing why I'm so passionate about this is that a lot of people are afraid to talk about health. You talk about everything else, our career, we want to have control over that. But when it comes to health, we tend to shy away. And I know that's for various or a myriad different reasons, but we can no longer be afraid to talk about this. And so that's why I'm so passionate about it. We need to have the knowledge to advocate for ourselves in that doctor's office and to make sure that we're getting the proper and best treatment. Statistically, I'm sorry, next slide. If you can. Thank you. A little bit about blood cancers. A lot of people do not know what they are because it is more rare than a breast cancer or a prostate cancer. But blood cancer can affect all of us at any age and at any time. If you can, think about really quickly your favorite 30-minute TV show. In that 30 minutes, at least 10 people will be diagnosed with a blood cancer. Also, if we think about pediatric cancers, I'm going to say about 20 years and younger, pediatric cancers, blood cancers make 40% of all pediatric cancers. That's a huge number. And specifically in the Black community, multiple myeloma, we are twice as likely to be diagnosed with multiple myeloma. And we are being diagnosed at younger ages than what the typical average age is. One of our own ambassadors, as we call them, he was 35 when he was diagnosed with multiple myeloma, and that average age is about 70. So it's affecting us all right now. And I think that's really cool how I'm coming right after Mrs. Chapman, but talking about environmental reasons or environmental health. Right now, we're starting to see that firefighters are getting blood cancers because of the chemicals that they're coming up against. Flint, Michigan is starting to see higher instances of blood cancer because of their environmental factors. We can even go deeper into that where since we are a national organization, we do a lot of studies throughout the country, and the Appalachian regions, those people are starting to get higher instances of blood cancer as well. You're thinking about talking, they're coming in contact with a lot of coal and those minerals. So it can happen to anyone, and that's exactly why we are here, is to make sure that if you are diagnosed, not to be afraid of it, but that you have resources here to help and support. And these resources are all free. So if anything you take away from today, we have, and it's not listed here, but in order to get in touch with all of these resources listed, we have our Information Resource Center who can connect you to all of the resources that we have, from the financial aid to clinical trial support to our nutrition assistance programs. They connect you to all of it. You can get to them, and I'll also put this in the chat. You can call them at 1-800-955-4572. Again, that is 1-800-955-4572. They will connect you to everything. These are trained oncology social workers. But talking a little bit about the programs that we do have, and we have a lot, but I'll highlight just a couple of them. In our financial support, we do have a free $100. If you call us, you get a free $100 to use to whatever you want. If you are diagnosed with a blood cancer, if you need to use that for gas for transportation, if you need to use that for copay assistance, you can do that as well. We do have copay assistance programs, travel assistance. You will just have to call to get connected with them. We do have educational support. We have a ton of that, from booklets that we can send to your home for free. You don't have to worry about shipping. If you're interested in having your doctor's office have them, we can send them to your doctor's office. They have a ton of information about the type of treatments and medications that are out there now. We have a podcast. Am I the only, can I not hear, or can you not hear me?
We can hear you.
Okay. We do have a podcast called The Bloodline with LLS. We also have local programs, educational programs, where panelists speak, doctors speak. We just had one in December called Caregiving for Black Families. And then last slide. So out of all of those resources, I'm sorry, can you go to the next slide? Thank you. Out of all of those resources that we have, we are ready to partner, and we're ready to share this information that we do have. You can either contact my manager, Lauren Frizel. She does all of Michigan and all of Indiana, or you can contact me. I'm here, Detroit, Metro Detroit, Wayne, Washtenaw, Monroe counties, that we can get these programs out to. We are so ready to partner, and most importantly, partner creatively in ways that haven't happened before. How we have partnered with churches in the past are through Myeloma Sundays, for example, where we'll have a table up during the month, and then during one specific Sunday, you can invite us, and we'll take about 15 to 20 minutes just to talk to your congregation about the blood cancer, about their signs and symptoms. Usually we'll have a person who has actually been diagnosed with the blood cancer. We'll have a doctor or a social worker who will be there, as well as me and or Lauren, who can talk about the services that we provide. We also have an ambassador program where you can volunteer to share more, to do more in the community, to volunteer your time however you so choose to do, and we will help push you in any way that you choose to go. And then, of course, we also do community health fairs, community events. We are in talks of doing like an Easter egg hunt health fair with a church down in Inkster coming up. So we're ready to work with you all. We're ready to share any of those resources as well. I will put more of my contact information in the chat and our website as well. So thank you.
Thank you so much, Miss Austin. This was amazing. So we are going to move on to a presentation by Shakira Tunstall for the Wayne Mobile Health Unit.
Hi, good evening, everybody. I'm Shakira Tunstall. I am the administrative coordinator for the Wayne Health Mobile Unit. So the Wayne Health Mobile Unit was established in partnership with Wayne State University, and our mission is to provide access to high-quality, portable, patient-centric preventative health care to the underserved and the underinsured in Southeast Michigan. We provide screening services and linkage to care for those individuals who are at a greater risk of developing long-term illnesses. Next slide. Here are some of our services that we provide. Our general health screenings, which include a high blood pressure screening, peripheral arterial disease, elevated cholesterol, diabetes, liver and kidney health, COVID testing for symptomatic individuals. We also offer vaccines, our standard influenza vaccine, as well as the new COVID vaccine. Other services that may be available are the HIV screening, which we can provide results within 20 minutes. We also have hepatitis B, hepatitis C, and syphilis. There's also no appointment that is needed. We're always elevating in our services. So these are just some of the services that we offer. But we also have our SSP services, which is our safe syringe services that we offer to different organizations to provide people who are drug users with a safer way to be able to utilize those utilize whatever drug that they're using. So we provide the clean and safe syringes. We also go out to organizations to provide some of our women's health screenings. One of the collaborations that we have is Alternative for Girls. So we do go out and provide some of those women's screenings for STIs and STDs screenings there. We also do some sports physicals as well, but these are just some of our general screenings that we provide a lot of times at our community health fairs or some of the partners that are just on this call today that we work with to provide services. Next screen. And this is our contact information. This number here is the office number. It's the general line that you can reach out to someone, and they'll be able to connect you with someone that can get you scheduled, or maybe you have already received services and you're looking to get your results, maybe your lab results or your screening for maybe you got a COVID test. So they'll be able to assist you, and you can always scan this QR code to see of all of our upcoming events. It'll take you to our public calendar. You'll be able to see where we're at each day. We are in full operation Monday through Saturday, and sometimes we do have events on Sunday. And if you have questions, like if you want to come and have an event with us, you can always reach out to that number, as well as look at our social media at Wayne_mobile_health_unit. And that was it. Thank you.
Thank you, Ms. Tunstall. We are going to move on to a presentation by the Institute of Gerontology and Healthier Black Elders by Amanda Horn.
everyone. I am also joined by my colleague Vanessa Rorai, who is going to be talking about the Institute of Gerontology and some of our other programs that we have there first. So I will let her take over.
Good evening, everyone. It's great to be here. And I have to say, this has just been so amazing hearing everyone's presentations and all these programs and resources. I just love hearing all of this information. I'm really excited to share it with our members as well. So real quick, my name is Vanessa Rorai, and as Amanda said, we're both from the Institute of Gerontology at Wayne State University. I'm going to quickly share a couple programs out of the Institute of Gerontology, and then we'll segue over to the Healthier Black Elders Center. First, I want to share a program called SAFE, which stands for Successful Aging Through Financial Empowerment. This is an amazing grant-funded program. There's no cost to using these services, and it's coordinated by my colleague, Latoya Hall. She works one-on-one with older adults to address and resolve various financial situations. So it can be really simple things like financial coaching and budgeting to more significant things like scams, fraud, identity theft, and things like that. So she will work one-on-one and go step by step to address and resolve whatever the situation may be. She's connected to a fantastic network of vetted other professionals. So if she can't help and resolve the problem, she has great referrals that she can connect older adults with. She also does a ton of community education on just being awareness of scams and how to protect your finances. So it's a really fantastic program to refer anyone that may have experienced any type of scam or identity theft. The other website I want to share with you is called olderadultnestegg.com. This was launched by the IOG director, Dr. Peter Lichtenberg. Dr. Lichtenberg has done a ton of work and research in the area of financial well-being among older adults. And Older Adult Nest Egg has an immense amount of resource information for older adults, caregivers, family, friends, all on managing finances. There's some really great tools and resources where you can actually go through an assessment and you can find out more information about your own financial decision-making, a loved one's financial decision-making. You can get a rated score that'll tell you a vulnerability to exploitation. There's videos and vignettes that help you have difficult conversations. And I should say Older Adult Nest Egg and the SAFE program both have caregiver components where they teach you best practices when you're helping managing the finances of someone else, of a loved one. Lastly, I'll just share our IOG website. We put on different types of events and send out different information. And so if you're interested in keeping in the loop of what we've got going on, you can visit our website and sign up to receive our email blasts. Some of our annual conferences are the Art of Aging, which is coming up in June. So such a fun day. It's really a celebration of art and health all together. We also put on a caregiving conference, Issues in Aging, and then we also send a caregiver connection email blast. Next slide.
All right, I will go ahead and take over. So my name is Amanda Horn, and I'm the Community Outreach Coordinator for the Healthier Black Elders Center within the Institute of Gerontology at Wayne State University. And our program can be broken into two parts. The first part of our program and our core goal is to invite older African Americans who are 55 and older to become a member with us, and we encourage them to participate in non-clinical health-based research, as this is one way to further understand and combat health disparities. And I will touch on more of that in just a moment. Currently, we have almost 1,200 older African Americans in our research registry, and they receive a biannual newsletter with all of our research information, all of our lunch and learn events, as well as other interesting articles. Next slide, please. And the second part of our program is our community health education events called Lunch and Learns. So we hold about 8 to 10 of these each year, and they're based on a variety of different health topics. So we work with our members and local organizations around Detroit to host these events. And we invite a speaker to come in and give a presentation about a specific health topic. And this usually varies based on what folks are finding interesting at that time. And we kind of base our lunch and learns off of that. And we also have resource tables, health screenings, and then at the end of these events, we pass out a healthy box lunch to all of our attendees. Next slide, please. And as I mentioned just a moment ago, so the core of our program is encouraging participation in non-clinical health-based research, which is something that we highlight in our newsletter and at our events. And we also invite our researchers to share information about their studies in person at our Lunch and Learns. All of the studies that we work with, they receive prior IRB approval, and then researchers submit an application to us, and it goes through our community advisory board members. And we have 16 older African Americans who make up our community advisory board, and they approve of all of the research studies that we work with. All of the majority of the studies that we work with do compensate participants for their time. Occasionally, one may not, and that's usually if it's a student who is working on their dissertation. And then we also stress that with all research, participation is voluntary, and it is not a requirement to become a member with us or to attend any of our events. To kind of round things up for the Healthier Black Elder Center, we do attend community events as resource tables and are always looking for ways to partner with community organizations. So if you would like to know more, please come see myself and Vanessa in the breakout rooms. And if you will go to the last slide, please. We have our contact information available here as well, and we can give that in the breakout rooms as well. So thank you, everyone.
Thank you so much. We are going to continue with a presentation on Wayne State University prevention, or What's Up, by Ari Hampton.
Good evening, everybody. How you doing today? My name is Ari Hampton. I'm the Manager of Prevention Services here at Wayne State University Prevention's team, also known as What's Up. I'm also an HIV activist nationally and internationally as well. So we can go to the next slide. So who we are, we're a compassionate team dedicated to the confidential delivery of client-centered health education services that impact the lives of Metro Detroit communities by building HIV awareness and creating systems of support. And some of the services that we provide, we can go to the next one. Some of our services, we provide free HIV testing in person. So we have drop-in hours, usually around from 8:30 to about 4 o'clock. For office hours in-person testing, but we also encourage everyone that if there are non-traditional testing hours that you would like, we can try to network that out. If you give us a call or just simply visit our website, and then you can kind of fill out some contact information, we'll reach out to you as soon as possible. And then that way we can work out whatever time works best for you. Also, we provide at-home self-testing kits for everyone in Wayne County, Washtenaw, Genesee, and I believe those ones. We have a lot of areas that we cover, but with that at-home testing process, you can do a screener through our website, which you'll see a little bit later, but it's What's Up 313, WSUP313.com. You can fill out a screener there. If you do qualify, we can mail you out an at-home HIV test kit. When you provide your results back, you do receive a $20 e-gift card to about 200 different stores you can kind of select through. We also have, like I said, flexible testing appointment hours. We have PrEP and NPEP referrals and navigation at our organization. So if you haven't heard of PrEP before, it's pre-exposure prophylactics, which is the pill that basically blocks out HIV exposure in people's systems. NPEP is post-exposure prophylactics. And so if you have been sexually assaulted, the condom breaks anywhere where you feel like you have been exposed to HIV, you can always give us a call and we can help you navigate that system so that you can get some medication. It's about a 2-pill combination for 28 days and it blocks out the exposure to the virus itself. So many ways to keep yourself negative and safe. We also provide linkage to care services for people. So as I said, I'm an HIV activist. I'm a person living with HIV for over 15 years. My job has always been to encourage people to get tested, know your status, know how to stay safe and negative if possible. But also the other side is if you were to contract the virus, what to do in that process and how to navigate health systems to make sure that you are achieving the best health outcomes as much as possible. Like I said, 15 years living with the virus. I was diagnosed before the age of 20. So I definitely try to help navigate a lot of young people just to make sure, there we go, just to make sure that they understand how to navigate healthcare systems and also to build that trust back with communities, specifically communities of color where we've seen the lack of distrust with healthcare systems and everything else. We also have our tobacco cessation program. So that focuses on young people living with HIV, reducing or stopping tobacco products as a whole. So we work very closely with a lot of different clinics around Wayne County just to make sure that we can provide those services, and anybody that's outside of those age ranges, we definitely have our tobacco specialist staff person that basically helps them navigate the quit hotline, receive any services that they need possible, all of that greatness. We also have at our home office our Refresh initiative. So we have a shower that's in the office itself. While the business hours are open from 8:30 to 4, we encourage anyone that needs to utilize those services, whether that is students or just community members as a whole, they can come and access those shower programs. We also have a clothing closet in-house as well. A lot of our clothes are professional development clothes. So anybody that's looking to go for a job interview, anything of that nature, we definitely try to have that apparel for the community members and especially the youth to make sure that they have every best outcome possible to achieve any outcomes that they're looking for, especially job searching. We also have volunteer opportunities at our agency as well, not just for community members, but also for anybody in nursing programs, which I currently have right now. We also have med students that we work with. Our wonderful leader, as you see in the picture up there with her daughter, is Dr. Angelique Outlaw, who's our wonderful director at our agency. We also provide a lot of work with the students. She also is interim postdoctoral dean. So we work with a lot of postdoctoral students as well with the BUILD project, which is really awesome. So a lot of research is happening there. We do a lot of community work, a lot of networking with other organizations just to make sure people have all the equipment that they need and resources they need to just navigate any healthcare systems that are possible for them. Our approach when it comes to testing and counseling is always motivational interviewing, MI approach. So we are not telling people what to do. We guide them to the options and allow the people to make best outcomes for themselves. And we want to encourage people to be a participant within their healthcare systems. So we're really trying to work with people to understand and be very transparent in what healthcare looks like and what sexual health needs to look like moving forward. So all of our services are completely free. We are funded through MDHHS, the Michigan Department of Human Health Services. We do not require any ID. We do not require any insurance. So people can access our services at any point that they need. And it's not just for youth, it's for everybody in the community. Although we do specialize primarily with LGBT youth of color and just youth in general. We wanted to make sure that everybody can access the services regardless of your age, regardless of where you come from. So we are an open door policy and our arms are wide open. And then we can go to the next slide. And so here we have some of our contact information. Our phone number is listed here. And that is a text service as well. So if anybody doesn't feel comfortable speaking to us over the phone, they can always shoot us a text, and we try to make it as confidential as possible. We want to make sure that people feel safe and they feel trusted within our agency. Because we are a drop-in center as well, we also encourage the community and the students on campus, where we're located on Woodward and Warren, that if you ever feel unsafe on campus, if you ever feel like something is threatening, you can always feel free to stop in, and we'll provide those resources or contact any departments that we need to in that moment. Our fax number is listed there. Our email is also there. Like I said, most people try to access us through our website, which is the WSUP313.com. It's really simple to remember. You can also access us through our Instagram and our Facebook as well. We're very accessible, and we contact everybody as much as possible. And as you can see in the pictures, these are some of our community-led events that we do. We do a lot of community work. We try to be innovative and have an artivism approach. So we always try to incorporate something fun and vibrant when it comes to sexual health, just because it's always a leery topic that people don't like to discuss. But when we're discussing HIV rates, especially in today's society, communities of color are really impacted by high rates of HIV transmission. And so we want to encourage everyone to have these conversations to really reduce the stigma that surrounds HIV. It's not just a gay disease. It's not anything that people feel like, you know, I can't get this. And so we want to open up the conversations and make sure that everybody feels safe and heard, and that you can achieve, you can obtain any information that you need to keep yourself safe and healthy. And so that's pretty much wraps up for what's up.
Awesome. This was great. Thank you so much, Mr. Hampton. Last but certainly not least, we have Lisa Saig from St. Patrick's Senior Center.
And wouldn't you know it, my mouse stopped working. I couldn't unmute myself. Thank you very much for inviting me this evening. I am the registered nurse and wellness clinic manager at St. Patrick's Senior Center. And if you've ever been to a concert at Orchestra Hall, you've probably walked right past our building and maybe not known anything about what we do, what we are. And a frequent question that I get is, how many people live there? The answer is nobody lives here. St. Pat's is Detroit's largest health, wellness, and activities center for people over the age of 55 from anywhere. We have center-based activities, in-home and outreach services, and our membership is open to anyone who's 55 and over. Like I said, we are right behind Orchestra Hall. We, as you see behind me, our historic building is 133 years old, but our program itself as a senior center is only 51 years old this year. And our members are 55 and better, but they are so young. So our old building is hiding all the vibrant, youthful activities going on at the senior center today. If I can have the next slide, please. We are collaborating with academic and community partners throughout the Metro Detroit area, and that has helped us to reach out to so many of our seniors. We provide nutritious home-cooked meals on site as a congregate meal program Monday through Friday from 11:30 to 1 o'clock. We ask for a $2 donation to defray the cost of those meals. We have a wellness promotion clinic. We provide non-emergency medical transportation in the Detroit, Highland Park, and Hamtramck areas to residents of those cities, as well as into the neighboring communities for appointments. We have a computer lab. We also provide mobile computer lab services to some locations. We have respite care and caregiver support, dance and exercise classes. We provide benefits enrollment assistance, and a great deal more. And we also have those evidence-based health promotion classes like enhanced fitness, a matter of balance for fall prevention, chronic disease self-management classes, powerful tools for caregivers, and our newest one is Mind Over Matter, which is bowel and bladder health for women. We were able to provide these classes not only on site at St. Pat's, but we're able to do outreach to churches, recreation centers, community centers, apartment buildings in Detroit, Highland Park, and Hamtramck. We also have partners at the helm that cover Harper Woods and Grosse Pointe. And even though we can go into those areas with our funding from the Detroit Area Agency on Aging, the helm is a little closer in those communities, so a little better suited to suit those areas. And I'm going to keep this short and sweet, but thank all of our community partners and academic partners that help us to provide all of these great services to our seniors, our 55 and better seniors. And if you can have the next slide for me, please. We are open from Monday through Friday, 8 to 4, second and third Saturdays of the month from 10 to 1. Lunch is served from 11:30 to 1, and you can reach us by the internet, www.stpatsrctr.org. You can call one of our numbers, and my phone number and email address is listed there. And I would be happy to talk to anyone in the breakout room for any more detailed questions, but we'd love to see you all there. Stop in and visit. Thank you.
Thank you so much, Mrs. Seig. So that presentation concludes our organization presentations for tonight. We are going to move on to our virtual networking session. Oh, if I can go to the next slide. We're going to move on to our virtual networking session. So if you go to the bottom of your screen, you should be able to see an option to join breakout rooms. And that'll bring up a list of all 11 organizations who presented today. You can choose whichever organization you want to go into their breakout room and talk with them a bit more. You can even go into one breakout room, come back into the main room, go into another one, whatever you choose. If you are having any issues joining breakout rooms, just unmute yourself and I will be able to help you out.
So before people go, this is Dr. Thompson again. Thank you, everyone. Thanks to all our presenters. This was an amazing event. I learned so much. We appreciate you being here. And we hope that everyone who's representing churches or other organizations feel, encouraged to reach out to people who presented and build, like I said, build relationships with these organizations. So we thank you from here. People are going to kind of do their own thing until the end of the session. And I think that's about it. Please complete our evaluation. We'll follow up with email and send it to you. And if you can't stay or there's an organization that you didn't get a chance to talk to, let us know and we'll connect you. And I think that is about it. Anything else, Alex, Rochelle, Kayla?
No, I think that's it.
I think you covered everything.
Okay. All right. So again, I hope that you have really great conversations in the breakout rooms, and we thank everyone for being here.